Welcome, everyone. We are talking with Miss Bonnie Wagner, who is a speech-language pathologist with Saint Thomas Midtown. And today we're going to be talking about stuttering. So if someone in your family, whether they be a child or an adult, is coping with stuttering and having that challenge in their speech, this is part of the program you definitely want to tune into and get some great information. Bonnie, if you can kind of define for everyone what stuttering is for folks who don't know.
Sure. So our governing body, which is the American Speech, Language, and Hearing Association, defines stuttering as a disruption in the fluency or the flow of speech. Okay. So the speech pattern would be disrupted by some type of change or a characteristic that stops or creates repetition in the speech.
Okay, there's three variations, I understand, too, of stuttering. If you can kind of talk about those three, and then we'll get into causes, too, if you don't
mind. Certainly. The three variations or characteristics of stuttering would be repetition, which I mentioned, and that is the sound repetition where it seems like someone gets caught in a loop.
On a word, yes.
On a word, or even a sound, usually the initial sound of a word, but not always. There is also prolongations. So a sound such as an L or an S or even a P might be held out for a long period of time and without release from that sound. Okay. And then the third one is a block where there is no sound. And so the person who stutters might begin to speak or be speaking and all of a sudden can make no sound at all, and that is a block.
And so you obviously, though, can tell that they're kind of stuck on that right now.
There's a difference between.
Okay. What causes, and maybe it's the same cause for all of them, but is there a different cause to where stuttering is brought on by folks? Well,
there's no one cause of stuttering. There are many, many theories about what causes stuttering, and therefore we look at the variations. For children, we're going to look at three different influences: genetic or hereditary influences, developmental influences when they're learning the language, and then environmental influences can create the stuttering. For adults who have stuttering, typically, if it's not developmental stuttering that has lasted for a long time, it's going to be created by a disease or a traumatic event, a brain injury or a stroke, or some type of condition such as a tumor or epilepsy.
Sure. You work primarily, I know, with adults.
I do.
And a lot of the folks that you just actually described in terms of, you know, those who actually have stuttering issues. Can stuttering be treated, or are you just kind of helping them along and just to kind of find those words and how to maybe take their time to, you know, be able to speak more clearly for themselves? I mean,
so there are a couple of different types of treatment.
Okay.
And the first type of treatment is a stuttering modification where you make the person comfortable with their speech pattern so that they can communicate within their environment with confidence.
That's great.
The second most common is a fluency shaping model. And so you are treating the speech pattern and trying to reduce the impact of the stutter and eliminate it in some cases.
So the people that you speak with, and like I said, the ones that you help and treat, they've obviously gone through, like you said, the traumatic type of event or something like that. Can they ever regain full speech again, though? I don't want to say curing stuttering, but can they get to the point to where all of a sudden they're able to speak as they once did before?
If it's developmental speech, the speech pattern is changed in a way that they didn't speak before, because as they're learning the speech or as they begin to speak from a young age, if it's hereditary, you are giving them a different way of speaking. For neurogenic speaking, or coming from a tumor or a traumatic brain injury, you're changing the way that the person speaks, you're changing the way that they interact with their speech, you're modifying some of the factors that affect the speech. And typically people are able to communicate in their own environment at the end of therapy. Most of them are not going on to be public speakers.
Yes,
but
yes.
Some people are, and there are many, many famous people who have been able to overcome their stuttering in certain situations, and who are able to act or give public addresses.
That's great.
Yeah.
But, you know, and obviously progress is made.
Yes.
How that's defined depends on the patient, obviously,
It really
and what
does.
they've experienced.
Their personal goals,
Sure,
and the learned behaviors that they have picked up along the way.
Yeah, that's good to know. All right, Bonnie, tell folks kind of how big of a population stutters. I mean, whether we're talking Tennessee statistics, if you have any, or on a national level.
We don't, that I could find, have any
Okay.
Tennessee statistics.
All right.
But nationally, we find that the incidence of stutterers is about 5%. That means that people who have stuttered at some point is about 5%. So the prevalence of stuttering for kindergartners is 2.4% nationally,
Okay.
and school-age children is about 1%. As you get into adults who stutter from a developmental standpoint or a hereditary standpoint, the prevalence is 1% or a little less than 1%.
And does it vary in terms of boy, girl, men, women, in terms of who stutters more, or if a certain gender does?
It certainly does. I believe that the male to female ratio in stuttering for school-age children or younger, kindergarten age, is 3 to 1. In school age, it is 1 to 1. And then as you get into the adult population, it's 4 to 1, male to female.
Okay. Also, for folks that you help, and I said in the very beginning, or even you did as well, talking about the adults that you work with, for those family members at home or friends of people who stutter, what's some advice you could give them, or some suggestions you can give them in terms of how to support their loved one and how to encourage them and help them when the speech therapist or speech pathologist is no longer in that setting? What can they do themselves to help?
For children, developmental stutterers, or even children who begin stuttering from a genetic or hereditary standpoint, you want to simplify the environment as much as possible. Children tend to get very overwhelmed, both emotionally and physically, and so keeping things quiet, having the TV off if you're having a conversation, those kind of things. And then the complexity of the message. So giving people who stutter the question or the statement that you want them to process in simple language.
Sure. Very good. And this is all great information, and hopefully folks will take the time and learn a little bit more, obviously, about stuttering too.
We hope so.
Yeah. All right, Bonnie Wagner with Saint Thomas Midtown. We so appreciate your time. It was so nice to meet you,
Thank you very
and
much.
you shared some really, really important information today.
Thank
you
you
very much.